Hi everyone, I'm Dr. Lipi and welcome to my show, Health, Humor, and Harmony. I hope you all had a good summer. I took a hiatus this summer, focusing on my health speaking company, Med, seeing patients with opioid use disorder, speaking internationally about media and medicine, and a bit of vacation in Berlin and Munich. I love German castles and apple strudels. But while traveling, I also caught Bill Maher's commentary about Matthew Perry on his show, HBO's Real Time with Bill Maher. September is also National Recovery Month. As a doctor who specializes in addiction medicine and is a frequent media medical commentator, I want to celebrate people who are in recovery. But I also have many thoughts about Bill's views. As many of you may know, I wrote about Perry's death and the proper way to treat opioid addiction. Not only do I treat patients with various substance use disorders, but I also oversaw addiction treatment and recovery services at Rikers Island Jail. And I travel across the United States and globally, speaking at the intersection of addiction treatment and prevention, mental illness, pain, trauma, incarceration, homeless health, and much more. In today's show, I'll address 5 key points in response to Bill Maher's video. Let's get started. Point number 1. Let's start with where I agree with Bill Maher, the role of these two doctors.
Doctors killed Matthew Perry, just like they killed Michael Jackson, Prince, Tom Petty, Elvis Presley. Doctors have killed more rock stars than twin-engine planes.
I firmly believe that these two doctors who deliberately prescribed ketamine to Perry should be criminally punished to the full extent of the law. Doctors are held to a higher standard by the nature of our work. We are given the privilege of caring for people, prescribing powerful medicines like blood thinners and chemotherapy, and performing invasive procedures like endoscopies and open heart surgery. But with these privileges come responsibility. First, do no harm is what we're taught on the first day of medical school. When a doctor takes advantage of a patient's trust and vulnerability, as these vile doctors did with Matthew Perry, then they should be held accountable. In this case, they should go to prison. Point number 2, few bad apples is true.
The medical industrial complex says these are just a few bad apples, but are they? From 2006 to 2019, over 145 billion oxy and hydrocodone pills were prescribed, resulting in over 210,000 overdose deaths, and they weren't prescribed by the opiate fairy.
Bill makes the few bad apples comment somewhat sarcastically, then goes on to talk about 145 billion painkiller pills being prescribed. What Bill fails to mention is that most doctors, myself included, actually care deeply about patients. When patients go to the clinic with pain, physical or emotional, doctors want to genuinely help. Unfortunately, most physicians, including me, get little or no formal education in addiction during medical training. Combine that with aggressive marketing and blatant lies by pharma, namely Purdue, while scores of people were struggling with unemployment and depression, well, refilling a patient's Percocet script seemed like a helpful thing to do. Did some doctors deliberately misprescribe and reap financial benefits? Absolutely, and they should be punished. But they were the minority. There are unethical doctors, just like there are unethical lawyers, politicians, accountants. Most doctors go into medicine because it's a calling. They genuinely want to make a positive impact in people's lives. Point number 3, gateway drug is the first one you do.
People have been arguing forever about what the real gateway drug is. It's whatever is the first one you do. Beer, pot, or with kids today, the pharmaceutical shit their own parents and teachers put them on.
Bill is wrong here. Teenagers experiment all the time. Cigarettes, cannabis, alcohol, pills. The reality is that very few go on to develop an addiction. That said, in the addiction community, we know that just say no isn't realistic. But we do encourage kids to wait until they're 16 and older because younger brains are still developing and are more prone to harmful behaviors, including addiction. We also know that trauma and genetic predisposition are risk factors for young people and addiction. Point number 4, there's no problem you can't fix with a pill.
There's no problem you can't fix with a pill. Even if your problem is you take too many pills, we have a solution to that: another pill. Matthew's last rehab was at a pricey clinic in Switzerland where, instead of weaning him off the drugs he was on, which is how we naively assume rehab works, they simply gave him a different drug, which accomplished the goal.
As a physician and public health advocate, I absolutely support overall health through nutrition, exercise, and social supports. But sometimes, you need the modern-day miracle of a pill. It might be a little hard to believe, but the first-line treatment for 3 substance use disorders, opioids, alcohol, and tobacco, is medications. Remember, addiction is a chronic disease of the brain, and it needs chronic treatment, just like diabetes and high blood pressure. Opioid addiction is treated with methadone, buprenorphine, or Suboxone, and naltrexone. For alcohol addiction, medical treatment is naltrexone, disulfiram, and acamprosate. And for tobacco addiction, it's nicotine replacement therapy, i.e. patch, gum, lozenges, varenicline or Chantix, and bupropion or Wellbutrin. These medicines are effective because they bind receptors in the brain and reduce cravings. Long-term recovery is most effective when medications are combined with behavioral therapy or counseling and other support services, family, friends, job, education, hobbies. But sadly, most people with addiction aren't getting these medications largely because of stigma and lack of education, both by patients and health professionals. Let's reduce stigma by calling these pills medicines and not drugs. Speaking of stigma, point number 5, stigma still plagues people with addiction. I mean, even the title of Perry's book refers to his addiction as the big terrible thing. He can't even call it what it is. Addiction, whether it be to alcohol, pills, or gambling, is still a source of tremendous shame and guilt. People don't seek help for it because they think it's a moral failing or weakness. Addiction has crippled individuals, destroyed families, and decimated communities. From Ohio and West Virginia to Ireland and India, addiction transcends race, gender, and geography. But the good news is that help is available. 2 key points to remember. First, addiction is a chronic disease of the brain, not a choice or a sign of weakness. Second, most people with addiction, once connected to the appropriate treatment and recovery services, get better. At the end of the day, I think Bill Maher is just frustrated and upset with Matthew Perry's death. We all are. It frankly pisses me off that 2 despicable men and a ketamine queen prioritized profit over Perry's life. It pisses me off that many private, for-profit rehab centers have no regulation or oversight and therefore overcharge and exploit people during their darkest moments. We don't treat other sick people this way. When's the last time you saw a high-end luxury heart attack rehab center that charges $80,000 for horse therapy? People with substance use disorders need compassionate, science-driven treatment harm reduction, and recovery services that are overseen by regulatory groups and covered by insurance so families don't go bankrupt over ineffective nonsense interventions. And while I'm glad that Bill Maher is bringing attention to the topic of addiction, facts matter more than opinions because the true facts about addiction treatment can save lives. Bill, if you ever want to have an actual honest conversation with an addiction doctor on your show about alcohol, drugs, addiction, and treatment, I'm available. So how can you get involved? Read about and or donate your money or time to organizations dedicated to addiction and mental health, such as the American Society of Addiction Medicine, or ASAM, the National Institute of Drug Abuse, or NIDA, the National Alliance on Mental Illness, or NAMI, or SAMHSA, Substance Abuse and Mental Health Services Administration, and many more. Well, that's all for today. Here's your joke of the day, comedy style. What did the doctor with a degree in comedy do? She left her patients in stitches. Be sure to like and subscribe to my YouTube channel, write a comment below, and follow my Instagram at Health Humor Harmony Dr. Roy. Be well, and I'll see you soon.